Welcome to After the Bell, a podcast for cancer thrivers. I am Lauren Kramer, your host, and I am a stage 3 breast cancer while pregnant survivor. And here on this podcast, we talk about all things cancer, all things resiliency, and share cancer patients, survivors, thrivers stories. So hopefully it could reach the right person. Today we're talking to Cristy. She is stage 4 breast cancer, invasive ductal carcinoma, hormone positive, HER2 negative. She was diagnosed at 39 years old. She is a mother, and even though she is going under active treatment, she wants to give others some hope that they can get through this. She's had little side effects from everything done so far, and she's stayed physically fit and eats healthy and uses holistic tools alongside conventional treatments to get through this. Most importantly, Cristy's message to you is to keep fucking going. Hi, Cristy. How are you?
Hi, good. How are you?
I'm excited to have you here. I know we kind of been like chatting back and forth for a little while online, and this is our first time actually like sort of officially face to face. So how are you? How are you feeling right now?
I'm feeling really good, actually.
I love hearing that.
Yeah, I'm great.
Good. So tell me about your diagnosis. I know that you're in treatment right now, right?
So I guess you could consider it that, yes, but it's kind of like because I'm stage 4, they treat it more as like a chronic disease rather than
Right.
you ever get out of treatment, technically. So I'm on a targeted adjuvant therapy, which is what they refer to as a chemo pill that I take 3 weeks on, 1 week off. And then my cancer is hormone positive, so I also take the estrogen suppressors. I do the once a month injection, and then I take a daily pill for that as well.
Do you do Lupron or is it Zoladex?
I started with Lupron and I had a really weird bad reaction to it, so I switched to Zoladex and I haven't had any issues.
Oh wow. What reaction did you have?
It was
If you
weird,
don't.
and a lot of people think it was just because of anxiety from doing it, but I don't know because it was about 5 or 10 minutes after I got it. I was still at the hospital, and I felt like I was gonna pass out.
Oh wow.
I got really sweaty. I got dizzy. It was really weird. So I told my
Wow.
oncologist, and they were like, let's change it to something else."
It's better safe than sorry, right?
Right.
All right. So back to your diagnosis. How did it
So it started in March of last year. Me and my husband were just playing around with each other, joking around, and he grabbed my right breast and he said, "Oh, I noticed you have a little lump in there. I can feel it." And I immediately went into panic mode. And he's like, "Oh
Yeah.
my God, calm down. It's probably nothing." So the next week I
Typical
booked,
guy.
yeah, yeah. So the next week I booked an appointment with my gynecologist. She even didn't think it was anything.
Yeah.
She's like, "This doesn't feel like cancer to me." And of course, at the time I was 39 years old, so it was like, "Oh, this doesn't happen. You're too young," you know. So
Yeah.
she sent me off for the mammogram and then and an ultrasound. And next thing I knew, I was getting a biopsy, and then the rest is history.
So you were diagnosed first at stage 4, or was it
No. So
okay?
on the ultrasound, they saw that one of my lymph nodes was prominent. So
Okay.
I went at the first hospital that I started at, they did an MRI. And whenever they did the MRI, they saw there was actually 2 lymph nodes involved. And then I did a bone scan. Once I did the bone scan, they found a lesion on my T9 vertebrae in my spine. And then that's how it became the stage 4.
Wow. How did you how did you process that first initial like diagnosis and then taking it to the step of being stage 4? How did take me through how you were feeling and what that was like for you?
Not good. It was,
Yes.
I mean, all of this stuff in general, it took me probably even like 2 months to even say I had cancer.
Yeah.
It's a gut punch. And then it was like every time I would have one more test done and something else was found, it just kept for me getting worse and worse. And so I tanked emotionally, and it was not a good space for me. And then on top of it, the hospital that I started at was a well-known cancer center where I live. And so I thought that they would be the people for me, and it ended up not being that way. They were pushing things on me that I didn't agree with and refused to do any other treatment on me. So I was stuck in a really hard place, and to be dealing with cancer on top of somebody telling me I have no right to choose what I do with my own body was extremely frustrating.
So what were they, take me through that part in them telling you kind of what to do with your treatment.
So it went from you don't have to do chemo to we're not even going to do surgery on you unless you agree to chemo first. And I know there, and it was the red devil, the AC Taxol, and I know a
Yeah.
ton of people do that. I know that you've done some chemo, but for me, after doing my own research, I just felt like it wasn't for me. I didn't want to do it, and to have somebody tell me I had no choice, it was very scary for me. So I ended
Yeah.
up changing hospitals.
Oh, wow. That is scary because you're going to people who you want to have at least options in some realm. Like, hey, this is what we recommend, and these are some other options. But I can understand how that is so infuriating to have to deal with people telling you what to do, and that's it. No other
It
option.
it was, especially when you feel like it's a ticking time bomb, and it's like
Yeah.
I just wanted to get this out of me, and then to have somebody say, "Oh, no, we're not doing surgery on you." It
Yeah.
was scary. I felt like a number, and I just didn't like it. So I ended up switching to Mayo Clinic in Jacksonville, Florida, and it was a completely different ball game there. They said we don't treat stage 4 cancer with chemo. We do this instead, which is what I had asked about at the other hospital, and they said no, that was not an option. So it's just
Interesting.
amazing the difference
Yeah.
in treatment plan.
Do you remember what the rationale was as to why they wanted to do chemo first? Obviously, I know they like to shrink the cancer, but
Right. So yeah, so they had said that they didn't want to risk doing the surgery and me having complications from it, an infection or things not healing properly. And I don't know. But then when I went to Mayo, my surgeon there told me that the chemo wasn't even necessary to do first because it's not going to shrink the tumor so much that it would have made a difference for her to go
right.
ahead and just remove the tumor.
Interesting. That is so wild. So you were saying that the chemo didn't align with you. Is that just because you wanted to get the cancer out like surgically, or is there more to it than that?
There's a little bit more to it, and that yes, I wanted the cancer out of me, and it ended up being actually worse than what we had originally thought it was. It was, the chemo itself. After researching it and looking into it, having other people I know look into it, it basically was more for ovary suppression. Yes, this is systemic treatment, but for my hormone-driven cancer, it seemed like it was more for the ovary suppression side of it than anything else.
Interesting.
And with the side effects from that particular chemo, I just wasn't on board with it. And I feel
Yeah.
like quality of life is important, and that wasn't going to be an option for me if I stayed at this other hospital. But my tumor ended up being 5 centimeters, where we thought originally it was only 2 centimeters.
Yeah.
And then I had 9 lymph nodes removed. 5 were actually positive with tumor cells.
Oh, wow. And then, so that was first, and then you had said this already, but so they had the 5 lymph nodes positive, and then they found the in your spine after that.
They did. They found a
Okay.
small lesion in my spine that was a little over a half inch in size. I would have never known it was there. I didn't have any
Yeah.
pain from it, or I still don't. So we did some targeted radiation on that. They
Okay.
are treating me as curable rather than palliative because mine's considered oligometastatic, which means there's only so many lesions outside the primary tumor.
Okay.
So
Interesting.
that helps.
Yeah, absolutely. Yeah,
Yeah.
that I feel like that word, always gives a little bit more like hope, right? Like we're
Right.
treating it differently. So when you were when they found the lesion, was it from like a full body scan? I'm sorry if you said this already.
It was a bone scan.
A bone scan, right? Okay.
Mm-hmm.
And that was just standard, or were they just was this just confirming that before they made any other steps in terms of surgery?
Well, it was confirming it. They were just checking everything before we did anything else.
Okay. Okay. I see. At that part, so I didn't have any I only had certain amount of scans prior to starting my treatment, surgery and things like that just because I was pregnant. So I kind of missed that part of the process. Although I feel like the standard of practice for treating breast cancer, it's kind of rigid, but also it's different for everybody. So
It
it's
is.
crazy how different it could be for each individual person, even though there's very specific
Mm-hmm.
things that they're following. So
Right.
it always interests me about how different each person kind of goes through it.
It is, yeah. And I don't think badly of anybody that chooses to do chemo.
Of
I feel like,
course.
but that's the whole point, is I feel like we should all do what we feel like is best for ourselves.
Yeah,
So,
absolutely. And not everybody's going to understand, and it's just, it is what it
right,
is. It
right.
has to be. You have to be, you're the one going through it. You have to be confident in it. And that's really all that matters, I think.
Exactly, exactly.
um, so you were starting to be treated as with curable intent. Now, what did you take? Like, what was your next step?
After the surgery. So after surgery, I ended up actually having to have two surgeries because
Oh,
uh, she thought that she got negative margins, but there again, we didn't realize the tumor was so large. So there was like 1 millimeter of
ugh,
cancer cells left. So she had to go back in and do a re-excision, get the rest of that out. So then after that, I went into the radiation for the spine, which was only 5 sessions. And then I did the breast and lymph nodes after that. And then I started on the systemic treatment.
okay. And what was that systemic treatment?
It is called Kisqali. It is a
Okay.
targeted adjuvant therapy.
How do you feel on that?
I was so scared to take that because, again, it's one of those things that comes with so many side effects. And I have actually done very, very well with it. I haven't physically noticed anything other than maybe a little bit of fatigue. It has lowered
Amazing.
my white blood cell count, but I have done phenomenally well on it so far.
Amazing. I am so glad to hear that. Are you doing anything yourself to try to kind of combat the drug? Do you know what I mean? Like, are you
Oh,
like, what are
yeah,
you in terms of like
absolutely.
lifestyle? What are
Oh,
you
yeah.
doing?
So I have an acupuncturist. I have a naturopathic oncologist that I work with also to help me with the holistic side of things. So
Yeah.
I take some herbs and supplements. And then I also have a cancer exercise specialist that I work with that
Amazing.
helps me with weight training and keeping my bones strong. So I do a lot of exercising. I worked out right before I came on here. So yeah.
Awesome. That sounds perfect, to be honest. How now in terms of the oncologist that you're working with, is that what you
Mm-hmm.
said? What is he doing, or she, whoever it is, doing for you? Like, how are you guys working together?
So he prescribes me, calcium supplements, magnesium, and then, some turkey tail mushroom, things like that, just and other things to help keep my immune system strong, my bones strong, and kind of work synergistically with the chemo pill that I'm on.
Okay, perfect. That now, do you feel like so in comparison to like that, like him and the Western medicine world, like how do you feel between the two, in terms of your treatment and taking things to the next level in terms of trying to just feel your best while you're going through this?
So I've always leaned more holistic
Yeah.
than towards Western medicine. It was very hard for me to come to terms with the fact that I have to take medications now every day.
Yeah.
So I am definitely more on the holistic side of things. And actually, I have an integrative doctor at Mayo Clinic also that helps me with diet as well and supplemental things such as that. And between her and the naturopath, like they're like my favorite. They really help me feel more confident in what I'm doing and that this is going to work and help me for long term.
Amazing. Going through all of this, how have you dealt with the mindset factor of all of it? Obviously, it's devastating, when you're diagnosed and just learning about everything, going to all the doctors, surgery is everything. How have you gone through mentally? How are you doing mentally?
I have good days and I have bad days, and I think that's pretty standard with anybody
Yeah.
dealing with this. What has really helped me more than anything is I do have a therapist, and honestly, as cliche as it might sound to some people, God, faith, the Bible. I
Yeah.
had pulled away from all that for a long time, and I was doing things and living my life in a way that wasn't the best. I was binge drinking, eating like garbage, and just I had a lot of personal things that happened to me over the span of a couple years, and my body was in constant fight or flight mode.
Yeah.
So once I tried to just get rid of the negativity, I stopped drinking, I stopped eating fast food, and then I just started focusing more on meditation and with God and the Bible. that's really helped carry me through this, because like you can talk to your friends and,
Yeah.
your family, but unless somebody has been through this firsthand, they can empathize with you, but they can't really understand.
Yeah. Totally agree with that. And it's not that they don't try. I think
Right.
it's just the reality of the situation. Like you don't know until you're in there. And thank God they're not, but
Right.
it does make it harder for cancer patients and trying to connect with the people that are already in their lives, already close to them. And yeah, it definitely takes a whole another layer. So I'm really glad that you found that through all of this, like went back to your roots in a sense to kind of help you get through. Now, I just lost my train of thought. Hold on. I had a
Okay, you're
question.
good. Menopause brain.
It happens like 17 times a
I know.
day.
Same, trust me.
I'm like, it's almost like just like routine at this point.
I know. I know.
But so we were talking about your doctors, you going through, like what you're doing in terms of, your health. Now you said you feel in, the form that you filled out that you feel like you feel better than you think you have prior. Is that because of like your
Mhm.
change of habits or, take me
Yeah, I
through that?
definitely think it's my change in habits. Like, before all this, I weighed 125 pounds, and now that probably doesn't sound like a lot, but I am 4'11". So for
Okay.
me, I was getting a little chunky. I just physically, I would get out of breath easily. I just didn't feel good, and then binge drinking all the time on top of that, and then being hungover, dehydrated. I just felt like crap.
Yeah.
So I feel like it just gave me a reality check. Like so it's like, even though cancer sucks, it's kind of been a blessing in the same way, because I have actually taken care of myself now.
Yeah. Don't you hate saying that?
Yeah,
Because
I
I
hate
say
saying
that
that,
too. I
but
say that too, and I hate it saying it. But it's like I totally understand where you're coming from because I feel there's so much that it's different, and there's so much that's like, not that I would want it to be right, but there's so many things that have gotten better, whether it's because of it or changes that I've made after, like
mm-hmm.
that's related to going through this. And I say the same thing, but I just like there's something in me that like hates saying it
Yeah,
whatever I do.
yeah.
But I totally get it. So now are you like completely not drinking alcohol? Like what's your stance on that? Do you allow any balance or are you just totally
No, so one of the things with the Kisqali that I'm on is that you're really
oh
not supposed to drink alcohol with it, because it can also work synergistically and increase your liver enzymes. I haven't
yeah.
had that issue so far, but and my oncologist said, one glass here and there, fine, but what's the point? I've been
Right.
doing, it's been like 7 months since I've had alcohol now, so
Right.
I'm fine.
Yeah. I mean, I was when after I went through treatment, I totally like omitted so many things because I was just like very strict on myself. I have allowed bounds more so as time went on, but
Yeah.
um it's true. Like if I know alcohol is like such a huge topic like in the cancer world because it's alcohol, right? But at the
Hmm.
same time, we can't, always we can't be hard on ourselves for everything because going back to what you said before, I think that's what I wanted to ask you. When you said you were in fight or flight, you were just stressed out. I
Hmm.
feel like that is worse, like, than anything, like being I feel like a lot of cancer patients say like they've obviously experienced some kind of thing in their life that has caused them to be in that, like their constant like stress state, whether obviously mentally, but like that physical
Hmm.
response of
Oh yeah,
just,
absolutely.
yeah. And it wreaks havoc on your system. Like,
It does. It raises the cortisol, and then it's just.
and yeah, everything just goes south. And I say to people like, listen, if you're struggling that much over like making decisions or being perfect, sometimes it's not even worth it for all of that stress,
Right.
you
No,
know?
it's not. It's not for sure.
So you're a mom,
Hmm.
right?
I am.
How old is your son again? I think you said, was he eight?
He's 8. Yeah, he's
Eight.
8.
How are you going through this with him? Have you talked to him? What is life like this going through for you as a mom?
Um, it actually hasn't been too terrible. Once I, kind of came to terms with the diagnosis itself,
Yeah.
I sat down with him. I didn't want to get upset in front of him because I didn't want him to worry or be scared or anything like that. So I just explained it to him, and He's actually been even for 8 years old, he's been a pretty big support for me.
Oh,
Like if he ever does see me crying, he's like, he's like, I need to calm you down. Like you know, so
aw.
he's been really good with it though. He hasn't got upset. And I think it's also though because I do look normal to him still. Like I feel like maybe if I went through the chemo and all that, like even you had to do, it's scary. I think more for kids to see that than
Yeah, because you start looking the way you feel
right,
versus,
right.
anything else. Now, I know you said you work full time and homeschool, right?
Yes, yes.
Now, did you choose to homeschool because of all this, or were you always homeschooling?
No, we've always done it. It's mainly my husband that does the main part
Oh,
of it.
really?
Yeah, yeah, because he's home with my son all day. So Uh, yeah. So he does the main bulk of that. And then, yeah, I do work full time. And a shout out to my employer. She's been absolutely wonderful throughout this whole thing and
Oh,
letting me take off and do things that I need to do with all this because I know some are not so gracious with that. But
which is wild.
yeah, but no, we used to live like in the woods and the schools out there just weren't that great. So we
Yeah,
just started from that point, and we would like to integrate him into a school eventually. But for right now, the
yeah.
homeschooling thing is working good.
Because I was so interested in how, like, your story in regards to homeschooling, and you were working full time. I was like, how is she doing it all?
It's
Because
my
it's a
husband. My
lot.
husband's been my strongest support, backbone, help,
Oh,
everything with all this. So
I'm so happy to hear that. I
good,
know also sometimes that's not the case it's
right?
even harder that way. So it
It
makes
is.
such a difference to have like that rock.
It does. And like I was raw juicing for a while, and he like would sit there with me and it would be something we would just do together and raw juice like for hours in a day. And so yeah,
Wow.
he's been good.
So how long did you do that for? Was it like a protocol you were following or
So I'm sure you're probably familiar with Chris beat cancer, Chris
yeah.
work. Yeah. So that's
Yeah,
why I
who's
started
not?
doing it. Yeah, yeah. Yeah, I have his books, and I started with that. Now I don't feel like his stuff is a one size fits all plan, especially for somebody like me, because I'm down to like 95 pounds now. So I kind of had to back off of the juicing. On top of it, I was turning orange because I was
Oh,
consuming
jeez.
like 10 pounds of carrots a week
Oh
from
my
just juice.
gosh.
Yeah, yeah, it was a lot. So I had to kind of back off a little bit, but I'd like to start back up soonish.
Yeah. And so were you following what he was doing specifically, or were you just kind of taking like, I don't know how it is with his like system.
I was following him specifically. That was before I had like my naturopathic doctor, my integrative doctor. So I was specifically doing what he was saying because I liked everything that he was promoting. So
Yeah.
and like I said, I lost a lot of weight and I was really strict with everything, strict vegan, strict raw. But now it's like I've integrated some meat and things back into my diet, cheese, a little bit of dairy here and there in moderation, just to try to keep my weight, my protein levels up and such as that.
Yeah. And I'm glad you said that too, because I feel like some people think it's all or nothing. You could do all those things. Like you could follow a vegan lifestyle, but then you could not for a little while. Like you don't have to do
Right,
everything just by like what it's labeled as or what somebody says to fit what you need. And
right.
especially with Chris beats cancer himself, I feel like there's a lot of like it's like very polar opposite opinions regarding what he does
Hmm.
because of the way he's, like marketing himself, whatever it is. But ultimately, like, I feel like everybody, after you go through a diagnosis and you think of like your health and making changes, like, we all want the same things. We all want to not have cancer anymore or not have it grow or whatever that it
Right.
is. And if we're going to try our best, like the first things we could do is diet and lifestyle and
Absolutely.
exercise.
And
Every
and
like
that's
that
the thing. Yeah. Yeah. I mean, it's
that's where
either
you go to first.
right, exactly. And my goal was to just um, do every single thing that I could to get past this. I didn't give myself any other option. I was like, I'm going to do whatever I have to do, 100% all in, because
Yeah.
uh, 99% is easy, 100% is hard. So I went all in, full throttle, and because I was like, I've got a son, I've got a husband. I don't care if it's stage 4. I'm not going to let a doctor tell me or determine my prognosis. So
Yeah.
I went all in with it.
Good for you. It's so important. You know, it's extra pressure for you, but when you're committed to something and you will do anything you can to try to survive. Like
Exactly.
that's really what it is. You know, you'll
Yeah.
do whatever you need to do. And if that is eating the right things and moving your body and trying to feel good, why not go 100%? And I love what you said, 99% is easy, 100's hard. It's so true. It's so
It is.
true.
It is. And then like, like last year I turned 40 years old in October, and I remember like just dreading the big 40, like, oh my God, I'm so old. But whenever this all happened, I was like, I'm happy. I'm excited to turn 40 now. Like, I'm happy for another year, and I'm going to do all the things health wise I can do to make sure that I go year after year after year and keep
I love
going.
that. Good for you. I was thinking myself the same. I'm 30, I'll turn 37 this year, but I'm like, I want to be better. I mean, my goal is to get to 40, right? But
Right.
I want to be better. Like I want to do the right things so I could feel my best for longer, you know, and be
Exactly.
here longer and not have any, you know, like stay healthy as possible. Like, you know, it's such a shift in focus after you're diagnosed, and you know, it may be hard, but I think it's completely worth it. And I've said this before, like you fight for those little percentage points in the statistics, right?
Mm-hmm.
Like you have to fight for every little percent. And especially when you have like a son and a family, and
Mm-hmm.
it that adds even another layer to it.
Oh yeah, for sure.
I know I'm preaching to you, but I'm just saying,
No,
you know,
no,
to those.
preach, preach, please.
So where you're at now, like what would you have told yourself at diagnosis that you have learned through everything that you've been through to this point?
Probably to, my biggest thing so far has been the fear factor, and probably to just not be so scared of everything. The word cancer in itself is scary, but I would just tell myself, you can get through this, you will get through this, you're going to get through this, it's going to be fine. And I mean, the fear is still there even now. I mean, like whenever I had a PET scan December 30th, I was like, oh my God, I haven't gotten any good news so far. Please let me get good news. And I did. And then I have to do that again in 3 months and go through the whole
Yeah,
anxiety of it again. But, it is what it is. So,
you
and that's
have
what
to
I
do it.
think people don't really understand too, that are outside of the box of all this, that don't have cancer, is yes, I got a clear scan. That's great. I'm so happy and so excited about that. But this is not something that ever really ends.
Yeah.
It kind of keeps going, So
Yeah, you can't avoid it. Now,
no.
in terms of the scans, how many have you had so far? I guess since was it post surgery? Like what's your status in that?
I've only done one scan post surgery, and that was the full body PET scan that I did December 30th. Before
Oh, that
that,
was
yeah, that was the yeah,
I didn't realize that. Wow.
yeah,
I know you
yeah,
were telling me about that.
yeah.
That's a big deal that was good though.
That was the
And
first
it's a
one,
good
yeah.
start to, yeah.
The new, yeah,
Do
I
you
kicked off
feel
2025
that's
remission.
right?
And
Yes.
and I asked my oncologist, I was like, so does this mean I'm in remission? And she's like, on a macro level, yes, on a micro level, no. And I've always had fights with the oncologist because I'm like, just say yes. I'm in remission. Like, it's always so doom or gloom with them sometimes. It's just, whatever. But I was happy about it.
Yeah, you should be.
Yeah.
How did you do anything to cope with that anxiety with the scan?
I
Or was
prayed a
there
lot.
yeah.
I did a lot
Yeah.
of praying. I cried. I cried a lot. I mean, that was the main thing. That was prayer, prayer, prayer. So.
Yeah. And I feel like while we want to avoid the anxiety and the scan anxiety specifically, you know, it's going to be there. So I feel like
Mm-hmm.
allowing yourself to cry or allowing yourself to kind of like understand and accept that you're going to have the anxiety leading up to it also is a big help too. Like allowing
Mm-hmm.
yourself to feel through it, as cliche as that sounds, but
No, for
it's
sure.
now you have a couple months until your next scan.
Mm-hmm.
Are you do you feel like you're thinking about it often, or have you kind of like let go for now, and then you'll get to it
I,
when it gets a little closer?
yeah, I've kind of let go of it for now. Once
Good.
it pops up in my portal as scheduled, then I'll start building the anxiety again. But it's unnerving, especially at stage 4, even though it was only oligometastatic stage 4. Stage 4 is stage 4. It's always
It's
stage
not
4.
only. It's not
I know.
only.
Well,
You're like only.
I know. Oh yeah, yeah.
It's
And oh
crazy.
yeah, it's just like when the oncologist told me, you have the you have the good cancer. Oh, there's a good cancer. You don't have triple
Who
negative. You don't have this or that. You have hormone positive. This is good.
I've been
No.
told that too. I
Yeah.
understand. I mean, I get the sentiment, like there's more treatment options and things like that. But yeah, saying it's
Yeah.
the good cancer is never the way to go,
Right.
I think.
Right. Right.
Let's rephrase that a little bit. I know,
Yeah.
and I'll never forget too. It's so funny because I don't ever get mad at a singular person for not understanding how to you know, say something appropriately. There are
Mhm.
things you just never forget. And
No.
I remember I told somebody that what stage I thought I was at the time, or yeah, because I had thought I was one stage. That's neither here nor there. But they were like totally like not a big deal because they thought I was like it was like a lower stage at the time.
Yes.
And I was just like, no, that's a huge deal
I know.
regardless.
I've
And
gotten the same thing. Yeah.
it just felt so wild to hear. I mean, again, you don't know what you don't know, but having your oncologist say it's the good cancer is pretty funny in my
Well,
opinion.
yeah, and
But
on top of him saying that, see, I've actually switched oncologists out there since then because he
from
was
the
like,
Mayo,
yeah, for at the Mayo,
jeez.
because he was like, my second meeting with him said, I'm not going to give you a prognosis because we don't really know, but if you don't do exactly what I'm telling you to do, you have a year to live. And it's
Oh
like,
my God.
thanks for that, appreciate you. So
What does that
I
even
switched.
mean? I'm not going to give you a prognosis, but I'm going to give you a
Exactly.
prognosis.
Well, he was not very open minded. He wasn't open minded enough for me. He didn't like the fact he was getting frustrated with me because I research everything, and I
Which you should.
understand you should, yes, but so a lot of these doctors I found look at you like you're a complete idiot if you go against what they suggest or what they think. And it's funny because the integrative doctor there actually said conflicting things to what he said. So you got two doctors working in the same building that aren't even on the same page. So I switched oncologists.
It
But
sounds like that's great. Like it sounds like you're very aware of what's
I
going on,
am.
and also sounds like you're taking a lot of accountability and you advocate for yourself, which is not an easy. It sounds like it's easy because you're just saying but it's not. Like
It's not.
it's
It's not
hard.
when you have people, like it's like we take doctors and then we have God, and people put God and then they put doctors, and it's just it's maddening and it's so frustrating. And what I've told everyone is, it's always worth to get a second opinion, a third opinion. You'll never get too many opinions or regret getting too many opinions, and that's why I ended
Right.
up changing hospitals.
It's so true. And but even that in of itself, I feel like, people like doctors are they know more about this than majority of us, right? Because we've never
Sure,
been through it and
absolutely.
they deal with it all the time. And while that is true and they're very knowledgeable and not discounting doctors,
Mm-mm.
this is something they do every day. There's things
Mm-hmm.
that are going to get slipped through the cracks, and there's things that, they're not going to maybe talk to somebody the way they, or, like another doctor that they should. And
Right.
there's so many things that you have to be able to fill those gaps with.
Mm-hmm.
And it's not an easy thing to do. So, I think you're a great example of that for those who's listening. Don't take, if you don't trust something, you don't trust something. Ask
Right. If you
questions
don't feel good
and
about
ask someone
it,
else.
yeah, go with your gut instinct. Ask somebody else for sure.
That's okay.
Because
Yeah.
yeah, yeah. Because I was not. I'm not going to let somebody lump me into a category, a statistic, standardized care. No, this is my body. You're going to let me make my choices because they preach on quality of life, quality of life, quality of life. But I need a choice in that,
Yeah,
and what I want to do for myself.
absolutely. Good for you. Now you're going to be on this. How long? You're basically on the Casquale. Is that how you say it? For until the foreseeable future, right?
Yeah, so basically you take it until there is recurrence or toxicity,
Okay.
which sucks. But typically, because
Right.
what can happen with that drug is your body can become resistant to it, and then you have recurrence. But then they say, oh well, there's other options we can do after that. So I don't know. We'll see what happens. But I've done really well. They don't even have me on the maximum dosage that they typically
Amazing.
would put stage 4.
Yeah.
And because I'm responding to it so well, she's like, basically if it ain't broke, don't fix it. So we're just
Right.
staying where I'm at for now.
Now, do you know if they would increase that dose or would they just switch drugs completely if need be?
I think they would, if something else were to pop up, they would probably just increase the dose.
Okay. Well, I mean, I say that's better, but I mean, obviously the drug sucks, whatever, but
Right.
you have an option to go up before you
Right.
switch drugs.
That's
So
where
there's
I
like
would rather be.
another,
I'd rather be on the lower dose,
right.
and then, we'll see what happens to be on the higher dose, and then I get, something happens, and then I have to just change completely to something else that I'm not familiar with.
Absolutely. Absolutely. Now, what are your goals going forward? I know you're very, because you're very much like holistic based, you're focused on, feeling your best, doing the right thing for your body. Like what are your goals going forward for that?
So I plan to keep doing what I'm doing, exercising, weightlifting, holistic things, diet wise, stay on track with that, and just keep getting better and better at it, and maybe do a little bit more and more each day.
Yeah.
So
What's your exercise routine like?
I do a lot of functional exercises, and then weightlifting is a big thing. I have a trampoline too that I jump on for lymphatic system,
Yeah.
things like that. I go on bike rides. I have a bicycle that my parents actually just got me for Christmas.
Oh,
Yeah, so I do a lot of things like that.
amazing. And I want to go back. I forgot to ask during when you were talking about your family, your husband,
Mhm.
how is I know you said he was your rock, but how did he deal with you going through this? Was he ever, was he always just like the stable person for you, or did he ever like how did he deal with this? Because I know, that that's a huge thing for, your
Yeah.
husband or your person too.
He was very, I could tell just because I know him, he was very upset about all this at first, but he is so like he's a man's man. He doesn't really show emotion, but I know that it was bothering him, and he told me that he can't cry about it because he said he has to be strong for me. So if he
Mm,
cries about it, then he feels like he's failing. So
yeah.
he's really brought me through it. Every time I would say, I've asked him over and over again, especially in the beginning, I say, "Am I going to be okay?" And he looks at me and he says, "You are okay."
Oh,
So yeah,
that's a great response. You're
yeah,
here. You're right here. You're
yeah,
okay.
yeah,
Reeling it in a little bit, which is hard.
yeah.
So, is there anything that for those that are listening that you want to kind of, give some little insight toward your circumstance? Because there's definitely somewhere out there who's relating to your story, who is in similar shoes as you. What would you like to say to them if you were able to speak to them right now?
I would say from someone I am an extremely anxious person by nature. I'm always high stress, high anxiety. And then once this happened to me, it just puts everything into a new perspective. You kind of just calm down a little bit. So I would say, take a deep breath. There's so many like stage 4 breast cancers out there and other cancers too. It's not a death sentence. You will get through it. It might be hard in the beginning because it always is, all the unknowns, but you can absolutely get through it. Get a second opinion if you don't feel right about something. Research it if you don't feel right about it, and just keep fucking going.
I was waiting for you to say that.
I knew it. I figured you were because I know I said that to you. That's my quote, and I got that actually from my close friend of mine that is also dealing with stage 4 colon cancer. So me and her are back and forth all the time. We're like, keep fucking going, just keep
I'm
going.
sure.
Yeah,
Yeah. I mean, that's really the only thing you need to do.
yeah, yeah,
That
yeah.
is the goal, right? I'm sorry to hear about your friend. That is just devastating.
Yeah, but she's
I
tough.
mean,
I mean, she's tough, and she's been a good support for me also.
I'm sure you never want somebody to go through this, but it's a community that is necessary. I really truly
It
believe in
is.
that. I was like on the hunt for it when I was diagnosed.
Me
So
too. I've made some
I
great friends.
yeah, you have to. Like you have to somebody who gets it on that layer. And while I would never want that for your friend, but I'm glad that you guys have one another to be able to like communicate like that together because that kind of can get you out of a dark hole sometimes. And
Hmm.
It's
Oh
so
yeah, for
important.
sure. Absolutely. And I have another friend that I met that actually is the one that referred me to Mayo that is stage 4 terminal breast cancer, but she still works full time, and she sends me daily devotions, Bible devotions. I mean, it's all these people. That I met another girl at Mayo that was triple negative, and she's been great. She's been a rock for me too. And you find friends and people, and you all come together, and it just makes a world of a difference for how you feel mentally and emotionally and how you deal with it.
Absolutely. So true. All right. So if anybody wanted to reach out to you, are you welcome to have somebody
Oh
talk to
yeah.
you or reach out to you? Where could
Oh
they find you?
yeah. Instagram. Oh my God, I haven't even memorized my handle. If you want to, tag that.
I'll
That's
tag it. Yeah.
menopause
I'll,
brain and nerves right
I'll,
now. And then on
I'll put,
Facebook, oh, sorry, go ahead.
no, it's okay. Go ahead.
On Facebook, my name is just Cristy Cat. And I had TikTok, but with everything going
But
on,
now,
yeah, so much for that.
I know, right? Oh my gosh. Well, I will put all of your information in the caption just in case anybody does want to reach
Okay.
out. And I really appreciate you sharing your story. It is going to help somebody. And
I hope
I
so.
thank you
That was
for
my
that.
goal.
And I'm
I thank
happy
you for
that you're
having me.
feeling. Of course, yes. I look forward to continuing talking to you. But yes, thank you for everything. And I will talk to you very soon,
All
and
right.
we'll see you guys in the next one.
Thanks.